So lots of different types of implants on the marketplace today for patients to decide on. We talked a little bit about what was called a simpler implant, or another term for them could be a mini implant, where there's a one-stage implant and a two-stage implant. A one-stage is where the patient goes in, it's just under local freezing, and the implants are a little bit skinnier, so therefore they can just be put right directly into the patient's mouth. Okay, and it's just one surgery. The patient just goes in, local freezing, they go right through the tissue, and it's placed. Okay, we also have what's called a two-stage implant. Now, a two-stage implant is where the implant is placed first into the patient's mouth, and there's a little bit of a healing process. If I kind of cover the little attachment, we can kind of see the implants in this model, which would represent, if we could see into the bone of a patient, that's what it would look like in the jawbone. So the implant is placed right in here, and then it has to heal for about 3 months. After 3 months of healing, there'd be a little silver cap on top that we would remove, and then we can put on, these are called abutments. This is what's called a locator abutment. Probably one of the most common implant systems in the marketplace that a lot of denturists use. Locator abutments are interchangeable parts, so we can remove this and I can put a taller one, a smaller one, however that would work. The advantage to the locator that I prefer for my patients is that inside the denture, again, there's little silver caps, or a little what's called a housing, and then there's multicolored units that can be put in, and the little green thing in there, there's different colors, but each one represents a different retention. So the nice thing for the patient is when the implants are anchored down, okay, we can then justify how tight we want the denture to fit, again, for the age of the patient. If it's an elderly patient, we use a little lighter retention. You know, a younger patient, we might want to lock it down a little bit harder. So this is a lower implant system using locators, 4 implants. The advantage to this is that down the road, if the patient comes in and they say, hey, you know what, Mike, I've been wearing the denture, it's anchored in, I like it, but I've heard about these fixed cases, something that's actually screwed into the mouth that's not removable. What that looks like is just simply a similar concept. We put 4 implants into the patient's residual ridge, okay? The denture is then fabricated. It's like a little bridge that's made. It anchors right onto the implants, and we can see there's little holes in here that the denture base would be screwed right to the implants. So that's non-removable. The patient would come in once a year, we would remove it for cleaning, hygiene, and then back into the mouth, and away they go. The only other one thing that I'd like to show you guys is this. Patients that wear an upper denture. Historically, an upper denture has the full roof of the mouth covered. The whole palate area of the patient's mouth is covered. So we lose a lot of our taste and a lot of our sensation for foods. With using implants on an upper arch, the advantage to it is this. We can have a patient with an upper denture. If we put implants into the upper ridge, then we have 4 implants showing here. Again, using locator abutments. We have caps inserted or attachments inserted into the denture. Now that denture again snaps into place. The advantage to it is now we can remove the roof of the mouth for the patient out of the denture, so now they have their roof of their mouth is revealed again. They get better taste, better sensation for the foods. Very important for patients that have a high sensitivity to something touching the roof of their mouth as well. It can eliminate patients that struggle with wearing a denture because they get sensitivity. The denture tends to cause them to kind of choke a little bit on the case. This way we can anchor the dentures down. The other advantage is when you have a full set like this that's anchored on the top and anchored on the bottom, when the patient decides that they want to go and they want to bite into an apple, or they want to bite into something extremely hard on the front, historically with dentures, the back of the denture would want to let go. Now that they're anchored in place, no more problems.